Hi, I'm Jeannie Lavery, RDA. I'm one of the clinical trainers at IntelliScan 3D. Today I'm going to show you some tips and tricks on how to use your IntelliScan 3D scanner. I'm going to be showing you today how to scan an existing denture for a patient. So whether a patient comes in and they have their existing denture and it's ill-fitting, or they just want a copy of it and they want it replicated, we can scan extraorally outside of the patient's mouth, and it can be sent to the lab to be printed or milled. So the AI feature is located on the lower right of the screen, and it says AI. When it is gray, that means it's turned off. When it's blue, that means it's on. So again, when you're outside of the mouth, you want the AI off. So I'm going to start scanning this existing denture from the intaglio surface. With an existing denture, the chances of the internal being a little more rough than the polished, shiny palatal surface makes it for a little easier of a scan. So I want to fill all the intaglio surfaces and the rims here. And notice how I want to go slowly and have patience as I go through so that it picks up, especially the very thin, narrow portions, so that when I go to rotate the wand over to the buccal, it captures just like that. So after I get the intaglio, I can flip the wand over to the buccal. We do have some edit features on the system here, so we can erase some of the scatter that gets picked up when you're scanning. Notice how if I move the scanner away to reposition my hands to grab the denture at a different angle, it just pauses for me. The anterior incisal edges, being that they are so much thinner, sometimes are a little harder to capture. So again, keep the position of the wand as close as you can to the denture as you're scanning. We want to make sure to capture a full 360 of the denture. Notice how if I go back over an area that captured my finger a little bit, it will delete some of the data. So at this point, I've got almost all of it scanned. I can push the button on the wand, pause the scan, and review if I need to add any more information. Notice how the system highlights some of the areas in bright green, and also it did not clean up 100% of my glove. So if I select the Remove Isolated Data icon and click it one time, it will clean it up. So at this point, I can either go back in and add more data, but I have 100% of the intaglio surface, so that is enough for the full denture.